What immunotherapies are used in myeloma?
Well, I think there are several classes of immunotherapies. There are the antibodies, which are in a sense sort of a passive immunotherapy where antibody targeted against a myeloma protein like CD38 or SLAMF7, and I'm specifically talking about daratumumab or Darzalex targeting CD38 or elotuzumab targeting SLAMF7. These antibodies are highly effective in early relapse and are being studied now in first-line and frontline therapy. So that's one type of immunotherapy that is really entering the first-line treatment space and certainly approved in the early relapse setting. The other treatments, CAR T-cell therapy, probably will be the first to receive FDA approval. These are currently being investigated in late-stage myeloma, but trials are already planned and will likely start very soon, looking at patients with specific high-risk profiles who would likely derive greater benefit from a CAR T-cell approach, or potentially derive greater benefit from a CAR T-cell approach than traditional therapies. The bispecifics are earlier on in their development, but I think if they prove to be effective, there's no reason to think that they shouldn't move earlier, if not even as first-line therapy. I think that's true for all of the immune therapies, honestly, that eventually we might see these enter and maybe even in some ways supplant our current treatment paradigms, first-line treatment paradigms.
Can IMiDs be considered a form of immunotherapy?
They can potentially be considered a form of immunotherapy. I think one of the challenges of that is that they are not necessarily clearly directed at the myeloma. It's perhaps more of a non-specific immune activation. Some of it may be myeloma directed, some of it may not be. That is not very well understood, I think, at this point.